It was a sort of a moment of serendipity. I was at 2009 in Amsterdam at a conference, and I wanted to buy a laser lens for to shoot the retina, but they didn't have it. But they had a vitreous lens instead, and they gave it to me with a leaflet about floater laser treatment by John Karakov. And I thought it was so interesting that I ordered the lenses and ordered the book and read about it and was like, that sounds like a great therapy. And I convinced my colleagues that we should do it, so we ran a pilot and that worked out fine. And then it started really to move on. And patients started to flock in and were so happy that yeah, in no time I was like the expert. Yeah, that's a very interesting point. Have been a landslide of changes. When you look back at the numbers I did, like in the first year I did 70 patients, 70 eyes, and in the second year 120, and in the third 250. And considering the amount of time you spend on it, it takes now about 1/3 of my practice. And it started all when I launched my website, and when I got a lot of internet self-referrals and patients coming by advice of other patients. And that changed so much that right now, if I would stop doing it, I would have a lot of time. It's difficult to understand for eye doctors sometimes that people are actually disturbed by their floaters, because they have seen so many that are not disturbed by them that they will think that the ones that are complaining are often just complaining. And so patients are not being taken seriously. That's by many eye doctors. And but they're really disturbed by them. I like to compare it to a cinema. If you're in the audience and someone is walking in front of you, if he's standing right in front of you, you're very much disturbed by him. You want to do this and that, but it's just not working. And so it's like, you know, having sometimes something before you. It's like you have to do this and it will come back, and that and it will come back. That's very disturbing. It will drive them crazy. And their eye doctors tell them that there's no treatment, or maybe a very dangerous operation that they should not do. So then they go on the internet and find out that there's this laser treatment, floater laser treatment, that could be of help. So they are so interested and desperate that they want to do that. And many of them come back home happy. There's like two main chapters to this. One chapter is the optics. If the optics should allow you to look deep into the eye, and it's best if you can have the illumination beam a little bit to the side, because then you can have a better feeling of depth, like where you are. Sometimes if you have to go very deep, you'll have it coaxial, but that's more tricky because then you cannot see how deep you are. And so the optics must allow you to do this, and that's very important. And there's many lasers out that will not allow you to have coaxial view, because then the laser will be blocked. Or if you have it to the side, it won't go deep enough. So that's one point. Second point is that the laser itself should be able to fire in a rapid way, because you need to do a lot of shots. Maybe like on average like 500 shots per patient. And you're having a moving target, and if it's on the right position, you would like to fire like in a rapid way, and some of them have to reload for a while. So that's an important point. So optics and speed of the laser. Well, that basically accounts for any treatment we do in the eye. If you put the power too low, nothing will happen. And well, that's actually a preferred setting over too much, because then in that way you can cause like damage. And the thing is that there's not the same power all the time, because if you're anterior in the eye, you'll need less power than if you're posterior in the eye. It depends on the angle you're working in and the amount of tissue it's going through. So I normally start with low power and slowly increase it until you have the right power. And once you have the right power, you will see air bubbles, and then you know you're doing fine. And sometimes you you have a little bit too much power, then you can really feel like tuck in the eye. So then you know you have to lower it a little bit. Just remember, I know a term from survival training, which is 5 times P. That stands for proper preparation prevents poor performance. This basically means that if you want to do this, you have to be prepared. Because if you think, well, I'll just do it, you'll run in trouble. You might hit the lens or just not do it right. And then you might be convinced that this is a treatment which is a fraud and will not work. So you have to read about the subject. You can order a book written by John Karakov that explains everything about it and will explain you to check if your laser is right, will explain you which lenses you can use, and will explain you a lot about the vitreous and how to treat. And once you've read that, you could start practicing. You can try on egg white in a cup just to see what happens. It's kind of fun, but it's of course it's not the same as in a real eye. You can try, if you do a capsulotomy, you can just go a little deeper and see what happens. And what I did, I sort of dry practiced. I told patients, like, you know, I want to do this treatment, but I'm not going to do it yet. I just want to look with the vitreous lens at the laser to see what it looks like. And in that way you can practice finding the floaters, because that's difficult. You think like you put the lens on, you see the floater and bam, but it's like if this is the view of the retina, your view of the lens will be only this small, so you really have to know where you are. Because you're doing explosions in the eye, it's like minor, like small explosions, you should be aware that there's delicate structures on all sides not to hit. So if you use pseudophakic patients to begin with, you don't have to worry too much about the lens, and you only have to worry about the retina. So start with simple cases and visit one of the floater laser specialists. You can visit me in Amsterdam or Dr. Geller in Florida.